Hi, thanks for coming along today, and I thought that I would talk about vertebral compression fractures, and I'm going to talk about the way that you're going to diagnose them and the reason why 70% of vertebral fractures go undiagnosed. Quite an amazing number. Anyway, this picture is of some great skeletons in the Cambridge Museum of Natural History. It's really worth going to. So there's some ape skeletons here, obviously leading up to a human skeleton at the far end there, and it's a fantastic exhibition. If you're really into all things to do with the natural world, it's really worth going to. I went there a couple of weeks ago. Anyway, let's talk about compression fractures. They're really common problems. So in the blog post that goes with this video, I've got a whole load of information about it. So I'm not going to dwell on everything that I've written in the blog post. I really want to go over the main reason why they're missed. And if you remember, compression fractures in the spine happen commonly after falls and lifting injuries in people with osteoporosis, but often they'll either be in the upper lumbar spine or in the lower thoracic spine. So this one you can see on this lateral x-ray is of T12, and you can see that the vertebral body has lost height. The front of the vertebra is rather smaller than the back of the vertebra here, and there's this sort of dip, wedge shape going on in the vertebra. And the important thing to remember is that the vertebral body that we're looking at here is at the front of the spine. It's not at the back. And so what will happen when we examine the patient, or just say the GP's patient, God forbid, examines the patient and uses their fingers to feel the spine, they're feeling on the outside. So this is some way away from the area where the compression fracture has occurred. And what tends to happen is that they will assume that the patient hasn't had any significant injury, because when they examine the spine, there's nothing tender to palpation. Now, if someone's had a fall or something like that, you'll often find a little bit of sacroiliac tenderness, and it's easy for us as manual therapists to attribute all the patient's pain to the sacroiliac in that instance. But it's not the case. The pain is often quite diffuse because it's quite a deep pain. So the patient rarely points with the tip of their thumb or their fingertip at the area where the pain is. Often they really can't say just where the pain is when they're trying to demonstrate it to the clinician, to you. And when we palpate the spine, often we'll almost never find any tenderness with a compression fracture. And so if the patient's been to the GP before they come to us, the GP will have the same situation, and often they'll say this: you haven't broken anything. But they're wrong. And this is the whole point, really, is that really it's a mismatch. And what happens when the patient lies down, the fracture opens up. When the patient tries to turn over on our treatment couch, the fracture site gets moved and it's painful. And when the patient gets up again from the couch, the broken bits come together. And I like to think of it a bit like the jaws and the teeth of a T-Rex, a Tyrannosaurus Rex, like in this picture here. So it's pretty painful, and but there's a mismatch, and this is the clue. There's a mismatch between the amount of pain that the patient has and the lack of tenderness that we find when we palpate them. And that's your clue. And lots of other clinicians will miss it, but you're not going to miss it because you'll notice this mismatch. So when you examine the spine and you can't find the source of the pain, just think, okay, maybe the source of the pain is quite a deep anatomical source in the vertebral body, and that's going to be your clue. So have a look at the rest of the blog post for the rest of the information I've given you about vertebral compression fractures. I hope you'll find it really helpful in making sure that you know everything about compression fractures, and that you're up to speed about vertebral compression fractures. Thanks for watching. Bye for now.